You're listening to Speaking Stellar Girl with Teri and an interview series that inspires women to live their most stellar life. Teri is the co-founder of the Stellar Girl movement, and she is sitting down with women all over the world to hear about the key moments in their lives and how they live boldly, compassionately, and ultimately became a stellar girl. Welcome to Speaking Stellar Girl. I'm your host, Teri, and I'm thrilled today to have Dr. Dendy Engelman joining me. Dr. Dendy is a board-certified dermatologist, a Mohs micrographic skin cancer surgeon, and aesthetic dermatologist in New York. Some of her celebrity and clients include Sylvia Vergara, Elle Macpherson, Christina Ricci, Kirsten Chenoweth, and Dorinda Medley, just to name a few. I can't wait to learn from you and talk all about skincare and what you do up in New York for all of your clients. We have so much to cover today, and thank you so much and welcome.
Thank you, Teri. Glad to be here.
So when did you decide to get into dermatology?
Well, I come from a lot of people in medicine in my family, and my dad is a general practitioner, and I kind of grew up thinking I would always do that. I wanted to be a doctor since 10th grade. He took our chemistry class to the hospital on a field trip, and I had wanted to be a lawyer up until that point. I'm not quite sure why. And then I go ahead to lawyers. And then I just fell in love with everything medical, and I loved the visual aspect of dermatology. My dad, I'm from South Carolina, and so there's the general practitioners take care of everything. He delivered babies. He worked 6 days a week. He did surgeries on Saturdays. So I always loved the procedural part of what he did, and I was super interested in that. But I loved dermatology because it was so, you could see the disease and you could see it getting better or see it worsening, and the patients really engaged in their own treatment, because if you have a plaque of psoriasis and you see that it's going away with the treatment, it's really compelling and it really engages your patient to be part of the journey with you. And so all of those things drew me to it. But dermatology is super, super competitive. And in the state of South Carolina where I train, there are only 3 spots in the whole state per year. So it's really hard to get into. So I was really, really lucky, because everyone's the same. So it really is luck at that point. To get a spot. And I joke that my father is the only dad in the world who was upset when his daughter matched in dermatology, because I think he wanted me to follow in his footsteps and do what he does, which is amazing. And I love that. But he, of course, is proud of me.
Of course.
We consult each other often throughout the week on different cases.
Well, you are an acclaimed dermatologist up in New York and actually all over the US. I'm from Chicago and heard all about you even back then. So your career has come such a long way. So have you always been interested in skin, or you were just sort of, okay, this is the path I'm going to take?
Well, I laugh now when I look back. I'll be 45 in November, and the fact that I ever thought about doing anything else in medicine is crazy, because if you look back at pictures of me and my cousin, my friends, we did spa days starting at like 8. We'd be all in my parents' like jacuzzi tub in our bathing suits doing like 8 million masks and the sea breeze and 15 hair conditioners, and I loved everything beauty, everything aesthetic. I was sneaking my mom's blush at like 6, and my little 3-year-old is always stealing my makeup. So it's funny, I've always definitely been into aesthetics, and I love that. I think what I'll try to teach my children, as I'm sure you do yours, is just find whatever you love, and then it never seems like work. So yes, I have always loved beauty and skin and all that goes along with that. And so it's lovely to be in a world where you get to help others in their journey, in their beauty journey, or their skin health journey. I mean, as a skin cancer surgeon, obviously it's not just about the beauty, but also health.
Of course. Well, you are a stellar billboard of your profession. You look absolutely beautiful. I do. Everyone always asks me this question. I don't know if that's often in your, well, I'm sure it's often in your world or your clients, but, people talk about, have you had Botox? Have you had filler? What are you comfortable talking about? And I mean, I lay it all out there. I am what I am, and yeah, I'm going to
get a little help along the way. But why do you think there's, challenges or misconceptions, or why are people scared to say, oh yeah, I got a little help from Botox or Dysport or a Juvederm? Like, why is that?
Yeah, I don't know. And I love that you're laying it all out there. I think that we as women need to champion each other and also share our secrets. And certainly for a while, it was very taboo. And even it's more regional, I think. I mean, if you're in the Midwest and I'm from South Carolina, it's still a little taboo. People don't talk about it. I mean, there'd be beautiful women who are well into their 60s who look great. And clearly they had some help other than the Pond's cold cream that they were claiming was their secret. Even their daughters, they wouldn't know what their mamas were doing. And I think that for those who aren't as savvy and know what all is out there, it is a gross disservice to your fellow woman that, you make all these celebrities who are like, oh, I've never done anything. I wouldn't inject anything. I've never done plastic surgery, where clearly they have. Right. And there's some lady in Iowa who is 60 and doesn't look like some of their age match celebrities and thinks that they're genetically flawed because they didn't age that way. And it's just physiologic aging, unless we do get a lot of help along the way or a little help. It doesn't tend to end as beautifully as we see on camera. So I always joke that anybody you see in Hollywood who you think hasn't had work has just had good work. The best work is undetectable, but if you can achieve a natural aesthetic that helps to have you age beautifully and appropriately. I don't think that 50-year-olds need to look 20. That's like kind of silly, I think. But I think that within a decade of looking younger is totally reasonable. And I do think, like you, Teri, if you share those secrets, my favorite comment is from Sofia Vergara, who told me, if you told me to eat crazy glue that'd make me look younger, I'd do it. She just is like, I will pull in anything.
Right.
But she looks beautiful and perfect and doesn't look overdone. She just looks great and timeless.
She does. She's beautiful, and she's,
she's 49 on Saturday.
Wow.
Is that the 10th? Anyway, she looks amazing. And
you've been training her for years. I've
treated her for years, and she's perfect when she walks in. I'm like, I don't even know what I'm going to do to you. She's so perfect and lovely. But I think that these are the billboards of like doing tiny tweaks where you really stave off the signs of aging is a good testament to what we do. We certainly see in the media things that have been overdone, and that kind of takes away from people's natural beauty. So we want to find ways to enhance natural beauty, but not take away from it.
Yeah, you are very careful. Like I was watching a few of your IGTVs on your Instagram, and you touch up people so they look their best, their natural self, without being overdone whatsoever. And the celebrities and the women that we see on camera, are a testament to that. So that's spectacular. What are a few misconceptions about, skincare that people may or may not know these days? I mean, like what's the difference between blue and red light therapy, or I've had PDT treatment for my skin issues. I mean, are there misconceptions out there that, that you might have a little, obviously you have the inside scoop on everything, but that some of our listeners may not know about?
Sure. Well, I think the vast misconception is often that you have to have a lot of money to have a good skincare routine. And I can help you find beauty on any budget that you have. And so that's one that I think we don't need to just think that everything needs to cost $1 trillion in order for you to help your skin look nicer. The drugstore brands, there are some lovely ones there that have done great things, and they're often owned by conglomerates who do the higher end and also the lower, more mass. So that's one misconception. The difference when you asked about blue light versus red light, we use that's called LED, light emitting diodes, and those are treatments that we use in office or at home to treat various skin conditions. The red light is anti-inflammatory, so that tends to be when people are worried about rosacea or signs of aging, those are ways to help increase blood flow and calm down inflammation. There's this whole concept in aging now about chronic inflammaging, where if your skin is inflamed for a long time, then it actually accelerates the signs of aging. And so those are ways to combat that. Even, you know, they even have those home LED masks that you can wear. And then blue light is often for acne, or in your case, when you were talking about PDT, photodynamic therapy, it's used in this country. It's typically used with topical ALA, which is a chemical that we put on the skin and let it incubate for about an hour, and then we expose it to blue light, which activates that for about 20 minutes, and that helps to reverse sun damage and treats actinic keratoses or sun-related growth that are indications of skin damage, and so they can be precursors to skin cancer. In Europe, they use that as an anti-aging treatment as well, because it does induce collagen. So patients here, often insurance will cover it, which is great because you're kind of getting a 2-for-1 benefit, that you're reversing sun damage and also your skin is going to look nicer from it. So if insurance covers it, I often recommend that because patients get so much benefit from skin health and skin, beauty.
Absolutely. So my PDT treatment was to treat obviously some sun damage, but also cystic acne. And I wasn't a candidate for Accutane, 10 years ago. So my dermatologist in Chicago suggested these 3 treatments, which the acid that you were talking about that goes in with the blue light is not a very pleasant procedure. You felt like you were on fire for those 20 minutes, and then you stayed out of the sun, which we all should do a little more of anyway. But I mean, as you know, my age, I was one of those girls when I was 16 on my rooftop with my girlfriends, holding tin foil and going from like sun tanning with baby oil. And now it's all, sunscreen, cover your face, sunshade, all of that. And, but there's so many chemicals in sunscreen these days. Are there any that you're worried about that are on the mass market that we should be aware of?
Yeah, I mean, a lot of them. And I've honestly gone to the point of, especially for my children, like nothing, I don't put any chemical blockers on them. I use only mineral ones, so zinc oxide and titanium. And, when you and I were coming along, you thought about zinc oxide, like the Australian surfer or the lifeguard who had the white nose, and it was literally like bright white, and you knew it was like a paste, almost like diaper paste. It was. That's made of zinc oxide as well. And now they've done beautiful ways to make the formulations way more cosmetically elegant, and they're micronized or they're coated with nanoparticles in order to keep that white cast from occurring, and they're more universal in every skin tone. So they're much more life friendly for every user. And we have to be mindful of, skin comes in many, many shades, and we don't want to nix out a whole, demographic because of skin tones or non-compatibility. So they're much more cosmetically elegant now, which is great and super inclusive. And so I categorically, and most dermatologists, if you really put our, a gun to our head, we would say that we would just stick to the mineral sunscreens. And that's certainly what we all choose for ourselves and for our families. And because I feel like almost every day we're hearing more and more about different either environmental effects or potential dangers of the chemical sunscreens. And so I just kind of say we have beautiful ones now that we can use that don't make you look like the white-nosed lifeguards. So why don't we lean into that? Because we know those are totally safe. They just sit on the surface of the skin. They really don't require any chemical conversion to be active like the chemical sunscreens. And they do a great job. The key is we have to also
brand that you can recommend?
Oh yeah, sure. I mean, the ones that I love, one is out of Barcelona. It's called Isdin, but it's available in the US now, ISDIN. And that's a great one that has 20% zinc in it. It has a crazy name. It's called Erythritona actinica, which just means redness from the sun. And then actinica, like actinic keratoses, also means from the sun. It's more of a Latin name, but it's very science driven. It actually has an enzyme in it that repairs DNA damage. So it's a real working sunscreen, but its component is made of zinc oxide. I love another company that's out of the US called Skin Better Science. They've done a beautiful job making physical sunscreens, mineral-based sunscreens. One comes in a compact, and it's like a sunscreen primer that is beautiful and elegant. And then they have a great one called Tone Smart. And then I love the powder ones because you and I are like makeup girls, right? So we're not going to, and then yet the dermatologist tells you reapply every 2 hours. If your face is all made up, you're not going to put on all over your made up face.
True.
But that's a great way to reapply is through the physical blockers with the powder. And then you can always have it in your bag. When you get on a plane, no one's taking it because it's not a liquid, so that's a great one to always have on as well. It's very easy and doesn't spill. And for my people who are outside exercisers too, that's a great one because it doesn't like sweat and drip in your eye and sting. So I feel like everyone can find a physical blocker that works for them. You just have to make sure you're trying, all the different forms that it comes in.
Do you feel that people need to put sunscreen on their scalp or on their head?
Yes, especially men.
Okay.
As a skin cancer surgeon, I have done skin cancer work a lot, but on the scalp, because we women tend to have more scalp coverage because of our hair and because there's more longer hair and typically more of it. Right. That's a block to the ultraviolet rays getting to the scalp, which is still skin. And men, as they thin, obviously have a little bit more scalp show and subsequently more damage. So I don't love the spray sunscreens as a formulation because you have to use so much more than you think of in order to really get the coverage that's on the bottle. But for the scalp, I like that, or the powder ones because they aren't, they won't make your hair all greasy. So that's a great way to use those as well.
That's awesome. Earlier, you were talking about, how we can better champion women and talk, freely and truly about, what our skincare routine is. And I'm always that girl that's like, if someone goes, "Oh, what are you wearing?" I'm going to like flip over the tag and like show her because Sure, I'll share everything. So at Stellar Girl, we're a community that supports and champions and elevates other women, and you're obviously an exemplary example of that. And how do you think we can better champion and celebrate women these days?
Well, I've been having this conversation a lot lately with all kinds of women who I have the great gift of having these almost mini TED Talks all day long with the titans of every industry in New York City, because I get to see the finance people and the lawyers and the entertainment people. And it's so fun to have all of New York kind of bring you their little threads and history and stories. And a lot of my patients are in the beauty industry, and they're editors for Vogue and Harpers and People magazine and all of that. And we've been talking a lot in these female run or majority female world where we're all cheerleaders and trying to lift each other up until someone's close to your level. And then the elbows come out and all of a sudden the claws come out, and there's this competitiveness or this passive, tearing down that is not getting us anywhere. And I think evolutionarily there is some weird trait that women have because we only have so many eggs to go around. There is some kind of competitive nature that you need to get, protection. You need to get, you need to get your man. And then when you're going to protect your babies, and you got to get the food. And so, I always go back to caveman days to think, where did this trait come from? Because women are so amazing until they feel threatened. And then it's like, we stop supporting each other. And I do think that the more we have that conversation and just recognize that we have this inherent potential to be competitive and not to uplift. If you own that and just look to recognize it, I think that will help us to continue to just celebrate each other, because there's enough room for all of us to thrive, right?
Yes.
I don't love that quality that we have. And it's like, you see it often. We joke that the women get up in the morning and sharpen their elbows so that they can
I think there's room for all of us to win. I think there's room for all of us to win. We don't have to compete. And, we don't want to compare, because that's the thief of joy. We want everyone to win. There's room for men to succeed. There's definitely room for all of us to succeed.
Yes, I agree.
Yeah.
And I think that once you come to that space of of recognition, and you have to, there's a lot of like self-love and self-championing that needs to go with that as well.
Yes.
Because what happens when you're feeling threatened? You feel like you're not enough, right? So if you feel like I am everything I need to be my best self at Stellar Girl or me at my office, then you do allow space for everybody else to thrive. Because Lord knows, I mean, you can throw a rock in New York and hit a cosmetic dermatologist on every block, but some of my very best friends are in my exact same space, and in theory, we're competitors, but I know that there is plenty of work to go around.
Yeah.
And so do they. And so we do tend to champion one another way more than those who came before us. And so I think that the change is coming, and it will continue, hopefully, to just get better, because there's plenty of room on this earth for us all to be champions.
Absolutely. That's fantastic. So let's talk about your upcoming book. What can you share? What can you tell us?
The world needs another beauty book, like they need another hole in their head.
That's not always true.
But I think that, what I want to bring is something that makes me unique in New York, which is kind of the Southern beauty perspective, and the little secrets that I've learned from my female relatives, and traits that have been passed on, but also with the knowledge and the expertise that my work provides me in all my studies. And so it'll kind of be anecdotal, but also with support of what is true and what is false, and hopefully like a very fun read, if nothing more, but also some education in there as well.
We're all missing a little fun in our lives. That's
Yeah.
for sure these days. That's what we at Stellar Girl, we're all about having fun, because that's what's missing. There's a lot of movements and organizations out there that celebrate and champion and empower women, but we do it with fun. We try to, like Stellar Girls, always leave a little sparkle behind. We created a glimmer lotion that glitters because we can always leave a little sparkle behind us.
Sparkle lotion, that's so cute.
Yes,
Looks great on you.
Oh, thank you. I will send you some as well. But like in regards to your little treats about your book, I mean, my grandma, you have all your relatives that my grandmother said, she put olive oil on her face, whether or not that was a good thing to do at the time. She passed at 97, but she ate garlic sandwiches. And she's like, garlic made me feel better. She never got a cold and made her skin glow. I mean, I highly doubt that's really
well. I mean, it's a great
proven.
She was ahead of J-Lo on that curve with the olive oil, so that's good. She's trendsetting. And then, I mean, garlic in the wellness and overall health has a lot of total body benefits.
Yeah.
And it probably kept her very healthy, because people stayed a little bit away because, didn't want to get too close.
You went too close. It'll permeate. So you're also going to be appearing on the Today Show coming up. And when has that been scheduled?
It hasn't been scheduled yet. We've been back and forth with the final run of segment, but I was on a few months ago. I go on fairly regularly, and they're so nice. They're like such a good family. Speaking of empowering one another,
yes,
they're really a sweet group. It's not just made for TV. They really love each other.
They're a great team of women over there as well. Absolutely. So is there one thing in your career, because you've achieved so much, is there one thing you would have done differently? Or wouldn't have you not changed a thing?
I don't know that I would change anything. I mean, even the things that were perceived setbacks, you learn from those. And I love the saying that disappointment doesn't happen to you, it happens for you. There's real or failures. You can insert a lot of words there, but they're really, make you who you are. And so I don't have anything that I would say, oh, I wish I'd done this sooner. I think the timing, as if I look back, even though I guess I would say I didn't have my first child until I was 39, and I love my little ones so much. I have a 3 and a 5-year-old, and if I weren't older, I would probably have more, maybe if I'd had that, but then I wouldn't be the same mom that I am now, and maybe I wasn't ready for that. So even that, I would say probably worked out as it should.
And the timing of your book, speaking of timing, when is that coming out?
Well, I don't know. It will be, it's been it's in the right works, but I don't know exactly when it'll come out yet, but I will certainly shout it from the rooftops when it is.
Heck yes, that's quite an accomplishment. That's an amazing, to get a publishing deal and to write your story, all the way from South Carolina, being a volleyball player that you were, so was I. And French is my major as well. Je parle français, je suis canadienne. So I'm from Canada, and French and languages were my major also. Yes.
All
Do you
right,
still
so
speak?
De temps en temps. I have had one patient ever who in the hospital who only spoke French.
Okay.
And that was it. That was the only time it came in handy in a medical sense. I mean, my husband, he speaks it as well. And we like to travel to France and we use the pen. But in the US, or even in Paris, you speak in, I do my best French with my Southern accent, and then they answer you in English. And you're like, I'm trying really hard.
I know. J'ai besoin de pratiquer. Exactly. No one wants to work with you. Everyone wants you to speak, exactly with their accent versus, the Canadian one or there's maybe the one from South Carolina, but
yeah, the South Carolina one is not well accepted. My husband, he is from Long Island, but he often, when we're in France, they'll think he's from Canada, which we'll take as a big win because that means they at least think that he had some native speaking. So I know all the vocabulary, and I tell him, and he says it with his good accent.
I do not think I could get through the medical vocabulary in French.
You could. It's very similar.
I appreciate you so much. I can't believe the time has flown by so fast. I'm looking at the clock. I'm like, it's already over half an hour. I really appreciate you sharing all of your tips and tricks, and the fact that you are so real and authentic in all that you do and all that you stand for. And you've made the most beautiful women even more beautiful. And I thank you so much. And we met through Francelle, who's also a Stellar Girl.
Yeah, I love her.
We all support and champion each other.
Thank you so much. Thanks, Teri.
So thank you.
Thanks for tuning in to today's episode. Make sure you subscribe to our YouTube channel and hit that bell icon to be notified of new episodes. To learn more about the Stellar Girl movement, please visit us at STELLARGIRL.com.